My name is Kirstin Mackay. I'm a medic health and safety advisor and I work offshore. So I've been asked to describe what the new normal is like from a health and safety and a medic perspective. And I don't know if anything really feels very normal for anyone right now. But what I can do is describe what we do from the medic perspective. A lot of things that will be worrying you right now are how we stem the spread of COVID-19 in an offshore environment. And that's very reliant upon hygiene measures. So in order to control and stop the spread, you might have noticed that manning levels have been reduced. On some platforms, this might start increasing now. COVID-19 is spread via droplets. So we know that in order to contain this virus, we need to up all hygiene measures. So that means cleaning cupboards between day and night shift if they are cohabiting, so a shift about. For us, we are not having day sharing cabins, so it enables cleaning in between individuals. We have implemented a contingency plan. This plan details where our isolation zones are, what cabin we will use for primary isolation of COVID-19 patients, how we remove people from the platform who are symptomatic and get them to a place of safety, and what's required hygiene measures afterwards and during. PPE is really important for us as frontline service providers, as the medic. So it's important we have adequate RPE and coveralls and suits, disposable gloves obviously, and aprons. So these are all put in place should someone be symptomatic. Now what we do is, if a person is off shift and they become symptomatic, they have the information in the cabin as to the phone number of the control room or the email address of the control room. If they don't have a phone in their cabin, they can raise the CRO this way. The CRO will get us up and out during the night or within shift, and we will don our PPE and go and see that individual in their cabin. If you're on shift, we obviously don't want someone who's symptomatic to be walking around the platform and potentially viral shedding. So you would go to the COVID cabin, pick up the phone and dial the medic, and the medic would see you there. These are different arrangements than what we're used to, obviously. From my health and safety hat now, what we know is that risk assessments have changed. Who knew that we would be doing a risk assessment to discover if it was safe to stand next to someone at a T-point? But here we are, this strange new reality we're living with. One of the things that you would have noticed is the snood. This is so you can sit on the helicopter, and obviously you can't maintain your 2-meter social distancing when you're sitting next to your colleague flying out. So this enables you to have a barrier method, very much like wearing a mask when you're coming to and from work. One of the things that people are asking is, when you're at your work site, how do you safely do your work if you can't keep social distancing? Well, one of the things I would say is that viral load is how you develop your symptoms. So the virus sheds, and the more virus particles you take in, the more likely you are to develop the virus. If you're standing within a meter of a colleague or closer and you're working, if you're in an exposed and open environment, that means that there's airflow and dilution, if you like. So you're less likely to get the same volume as if you were in the accommodation and you were standing next to someone who was viral shedding and perhaps shedding droplets toward you. Now that probably doesn't make you feel very secure anyway. However, one of the things that we are doing individually and as a company is looking at our work scopes and risk assessing. I never thought that we would have to look at pandemic when we were working out if we can change a valve, but that's where we're at. So for us, it's important to chunk a job, to move personnel around so that they're not working face to face in close quarters. It might mean cancelling jobs and pushing back work scopes. It certainly has changed the territory of which we're used to working. I think one of the things we have to be mindful of is that we work in a major accident hazard environment, and this is eclipsing our perception of risk. At the end of the day, the things that are so dangerous offshore are still so dangerous offshore. It's now got this confounding factor where we're actually working in pandemic spread as part of it. So I want you to still be mindful of your safe isolations, of transiting to and from work, of wearing your PPE correctly, of being aware of your process safety. All of the things that we are mindful of on day-to-day business, none of those hazards have changed. All those risks are still there. As a company, what we've done is we've tried to split day and night shift as much as we possibly can so that there isn't the congregation of people on day shift, so it makes it easier to maintain social distancing. And that's been a concerted effort, and it's taken a lot of time and energy to successfully do that, but it's working. Knocking on wood, we've not had any reports or infections or positives in the last month, so everything crossed. Stay safe out there.